Hi everyone, I'm Dr. Anil Venkitachalam and I am a consultant neurologist practicing in Mumbai. I mainly practice in Hiranandani Hospital in Powai and in Chembur. I am going to speak to you all today about myths and facts on epilepsy. So it's actually a misconception that epilepsy is a rare disease. Epilepsy is one of the most common neurological disorders which is found all over the world. Up to around 2% of the world's population at any point of time has epilepsy. It is estimated that up to 50 million people suffer from epilepsy. Epilepsy can affect any age, any race, and people of any socio-economic status. So in fact, epilepsy is a very common neurologies which is found all over the world. It is again a misconception that epilepsy is a mental or a psychiatric disorder. In fact, epilepsy is purely a neurological problem. Some features of psychiatric illnesses can be there in epilepsy, like epileptic patients can have auras, hallucinations, etc. But epilepsy per se is purely a neurological disease. It may be due to a genetic cause, it may be because of a structural problem in the brain such as a tumor, or it could be because of trauma or some injury in the brain, or it could be because of some sort of a malformation in the brain. So epilepsy is not a psychiatric or a mental illness as it's presumed to be. No, you should not try and stop a seizure. In fact, when a patient has a seizure, you should let the seizure be and let the seizure get over. If you try and stop a seizure, you're actually going to harm the patient more. The patient would suffer from injury, especially to his bones, especially to his hands, as well as the muscles. He could sustain like self-injuries. The other problem is that when you try and stop the seizure, you're not going to achieve anything. In fact, the easiest thing to do is when the patient has a seizure, just try to turn the patient onto one side and let the seizure just pass off. And then the patient can then be taken to the closest hospital so that he can be treated for the seizure. In fact, you should not put anything in the mouth during a seizure. It is again a common misconception that you should try and put something in the mouth in order to prevent injury to the tongue. Usually the patient would not bite his own tongue or swallow his own tongue during a seizure. The thing is, when a patient has a seizure, you just have to move the head to one side so that the patient does not choke. And once the seizure actually passes off, the patient should be alright. In fact, if you try to put something in the tongue, the patient could choke and the patient could get injuries to his mouth, which could cause more problems as well as like damage during the seizure. Yes, a patient with epilepsy can drive provided his seizures are under control and provided he has been authorized by the competent authority. If a patient has seizures and the seizures are very well controlled, he can lead a normal routine life. He should not have any problems driving, walking, working, etc. Now, if a patient has recurrent seizures which are not controlled even with medication, then driving may be a problem. But in general, around 80 to 85% of the patients who have epilepsy will be able to drive and they will be able to lead a normal life. So again here it's a misconception that in every seizure you should have loss of consciousness and you should have frothing from the mouth and you should have jerking of the hands and feet. In fact, there are many types of seizures where you don't have to have loss of consciousness. You can have periods where the patient has brief automatisms, so he may be smacking his lips, he may be moving his hands, or he may be briefly confused, he may be just staring, and he may be briefly confused and unaware. These are also called as absent seizures or complex partial seizures. These are in fact more common than the classical seizures where you have loss of consciousness and frothing from the mouth. So you need to be aware that there are various types of seizures and not every seizure is associated with loss of consciousness and frothing from the mouth. So it is again a myth that epilepsy cannot be controlled or cured. In fact, most epilepsies can be controlled and they can be cured. We have excellent medications which help to control the seizures. If a patient has seizures or epilepsy, a single drug can achieve control of seizures in 70% of the population. 2 drugs will achieve a control in around 80% of the population, and 3 or more drugs will help achieve a control in 85% of the population. In fact, only around 15% of the patients might not be well controlled with respect to medication. Even for them, we have advanced management for epilepsy, such as epilepsy surgery and vagal nerve stimulation, which are available, which helps to control the seizures. So if we look at it overall, the treatment options for patients with epilepsy are excellent, and we are able to achieve a very good control for epilepsy. Most patients with epilepsy, once they are well treated, do not have recurrence of their seizures if they are not defaulting their treatment. Some epilepsies would need treatment for the rest of their life, but most epilepsies do not need treatment for the rest of their lives. In fact, if a patient has a seizure or epilepsy, you need to give him anti-epileptic drugs for around 2 years to achieve control of the seizures. It is only in a small subgroup of patients where when we withdraw the anti-epileptic drugs, they get recurrent seizures, and we need to continue the anti-epileptics for the rest of their life. So in general, most patients would not need lifelong medications with anti-epileptics. It is very rare for a patient to actually die due to epilepsy. However, these are known to occur. These are rare situations, especially if a patient is not actually taking his treatment properly, if he's actually defaulting on the medications, or there is an entity which is known as sudden death or SUDEP in epilepsy, where a patient just, due to some unexplained reason, is actually found dead. Other causes where a patient actually has a mortality with respect to epilepsy is mainly when a patient is swimming and patient has a seizure, or patient drowns, etc. But these are very rare instances. Most of the times patients do not actually die with respect to epilepsy, since epilepsy can be well controlled with the medications. It is actually a misnomer that only children can have epilepsy. In fact, epilepsy can affect people of all ages. It is more common in the extremes of age. It's more common in young children under the age of 10 and elderly individuals over the age of 65. But we need to realize that epilepsy can affect people of all ages. So even people who are actually in the teenage years, people who are adolescents, people who are in the middle-age years can have epilepsy. So if patient has seizures, patient has recurrent seizures, you need to see that the patient is evaluated and try to find out the cause of the epileptic attack. So most epileptic patients can lead a normal life. Since we have very good medications for the treatment of epilepsy, most of the epileptics can lead a normal life. They would not have any problems with respect to their activities of daily living. They can have a normal married life, they can have children like normal people, they can go to work like normal people. Most of the epileptics do not have any problems leading a normal life. In fact, they can do everything which a normal person can do. So it is again a myth that all epilepsies run in families. In fact, there is only a small subgroup of patients where epilepsy runs in families. Most people who are epileptics have normal children. Their children do not have seizures or epilepsy. It's only in a small subgroup of the population where there's a genetic mutation that these patients have recurrent seizures and epilepsy. Otherwise, epilepsy can be due to a variety of reasons. It can be as a result of strokes, it can be as a result of some sort of tumor or some sort of a malformation in the brain. It can be as a result of a trauma or a brain injury. So it's not only due to a genetic cause, it could also be due to a variety of other causes related to the brain. So most women with epilepsy can lead a normal life. They can have a baby, they can breastfeed. However, if women who have epilepsy are planning to have a child, they need to have a discussion with their doctor so that they are started on appropriate anti-epileptic drugs and their seizures are well controlled prior to pregnancy so that they do not have any complications during pregnancy. Again, epilepsy and breastfeeding as well as like lactation have no issues. As I said earlier, most women with epilepsy can lead a normal life. They can have like babies like normal people, and they can have like normal like breastfeeding as well as like. I've sorted out some of the queries regarding epilepsy. It is important to come out and identify the disease so that we can treat it adequately and properly. Epilepsy should not remain a stigma anymore. We need to realize that epilepsy is a treatable disease and it can be well controlled. But only if the people come out and speak about the disease can they be treated appropriately. That's why we say, baat kare, ilaj kijiye. Thank you.